5422. AMP2.TV, the first and only internet television network that's truly plugged in. 866-224-5422. That's AMP2.TV. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. It's Monday night at 9. Time for Sex Talk with Dr. Richard Siegel, a certified sex therapist and sexuality educator. Dr. Siegel is here to answer all your questions about sex and sexuality that you might not have known who to ask. He'll also welcome special guests to talk about a wide variety of topics within the fascinating world of sexuality. So, welcome to Sex Talk.
Good evening. Welcome to Sex Talk. My name is Dr. Richard Siegel, and I'm on with my best guest, my number one droog, my best bro, Larry Siegel, clinical sexologist.
Hello. Glad to be here.
Thanks for coming back on the show.
Oh, my pleasure.
Give us a call, 888-565-1470. Or we're also streaming live on Facebook on the page of Sex Talk with Dr. Richard Siegel on WNN. You can type in some questions or use the chat feature or just pick up the phone. If you're listening local, we're on 1470 AM, 93.5 FM, or also streaming on the radio station's website, wwnnradio.com. So, Larry, I don't think I said last time we did the show together that continuing in this long tradition of inheriting your old jobs, I even took the show's title from your old Selkirk cable access TV show called Sex Talk. Right? People have to be old enough to know what cable access means.
From the late 80s.
Yeah, 1980s, right? That century.
Oh, yeah. Thank you for qualifying that.
Sure, yeah. You know, as a theme, can't help but notice this continuing presence of sex negativity around every attempt to, push the needle, push the needle towards better sexual health. I mean, we've been talking a lot about just what goofy jobs these are.
Yeah.
In a sexually healthy world, there would be no such thing as sexuality educators because that's what parents are. And sex therapists, like we talked about a couple of weeks ago, why aren't all therapists sex therapists?
Sure.
Right? Why is this weird specialty, and does that not continue to stigmatize the whole subject?
Well, I think certainly in a lot of ways it does. You know, for years I've sort of been, joking around, saying that as long as I live in this country, I'll never be out of a job.
Yeah.
And that's not anything that makes me feel good.
Right.
It kind of saddens me. Right? One of my fantasies, and I've got a few, but one of my fantasies that I can talk about here is sort of waking up one day and realizing that we get it.
Sure.
Right? We know what we have to do.
Yeah.
Right? We're doing it. It's not anything big deal. It's not anything we have to go out of our way for. We finally accept sex and sexuality as a part of who we are and what we do, and is finally a degree of normalcy that's set in. I guarantee you I'll be dancing in the unemployment lines.
I think you'd be waking up in Denmark or someplace.
Yeah, certainly not here.
That's part of the frustration of having these weird jobs, is that it's embarrassing that there's so many other places in the world that do get it, that sexuality and sexual health is a no-brainer. It's a matter-of-fact part of life. Remember that conference in Miami? Was it Venezuela? We were at the sexual medicine conference, and a physician from Venezuela said there were 21 sexual health clinics in the country. 21 sexual health clinics in Venezuela, and how many do we have in the United States?
Not only Venezuela, and earlier this year I was in Cuba, and Cuba actually has a very big and a very active sort of national clinical sexology organization, and they are very busy. They're out there. They're doing all kinds of things that we're not even doing here. So the fact that Venezuela and Cuba are seemingly more advanced in the acceptance and practice of sexual health is a little mind-boggling.
And why aren't we embarrassed about that?
Well, we
Right?
should be.
People in this country, it makes me nuts. Everybody loves to scream, US of A, we're the greatest country in the world, screw everybody else. And we fail.
Well,
We
that's
have
kind of our
such-
problem.
Yeah.
We have screwed everybody else.
Yeah.
And I think in the process, we're number one, we're number one. We lead the world in unintended pregnancies. We lead the world in sexually transmitted infections,
the measures.
including per capita rates of HIV and AIDS. We lead the world in sex crime, victimization, sexual problems. If it can go wrong with sex and sexuality, we are number
We're
one.
number one.
Right.
Yeah, it's something we
Right.
should be
And that's,
proud of.
we should get, I guess they have the big fingers for football games. So
Right,
we have
right.
like big foam penises that we can raise. Right? We're number one in everything that can go wrong with sex.
It's havoc, and like Marty Klein described it so many years ago, the sexual disaster industry. So everybody wants,
And the Oprahfication, another
right.
term he used there.
Another brilliant Marty Klein.
Yeah.
Everybody wants sex shows. It would be great if this one could be so sexy and salacious, and like this fantasy that we could do Howard Stern crap in here, but we end up talking about problems with sexual health,
Right.
and why attempts at getting sexually healthier are always stymied by this need to either we're afraid of sex, we demonize sex, we pathologize sex. So it seems the only comfort is if we can make a diagnosis out of it, right?
Right. And I think we can, even without going into, I think, where you're going with this in terms of this negative labeling and all this pathologizing. I don't remember who it was. I remember I first heard this idea through our friend Laura Riskel, a brilliant writer out in Colorado, who I think may have gotten it from, this may have come from Rabbi Shmuley, the sexual schizophrenia.
Yes, one of those rabbis in New York.
Yeah.
Yes, we always forgave
Not
him.
Shmuley, but one of,
I think it was Abraham Balfour, I want to say.
That sounds
I
more
tried
familiar.
to Google over the years, and we always forgave him the misuse of the term schizophrenia because it's such a great point.
Right. It
This
really
kind
is.
of split brain.
Right. Right.
What's the list?
Well, we can start with how we sort of introduce girls to sex and sexuality, particularly when we talk about losing their virginity. The common message for decades, I mean, probably even more than just decades, but certainly all throughout our lives and beyond, that how often are girls told, your first experience, it's special, it's wonderful, you'll remember it always, it's a beautiful experience, but it's going to hurt, so
like
try to
hell.
get drunk and get over with it.
Yeah.
I mean, that's not a good message.
Yeah.
Right? I remember getting in trouble when I was in elementary school. As a matter of fact, Mrs. Sorensen, if you're still alive and you're listening to this is where this got me. Being sent to the principal's office for questioning, I was in 5th grade, questioning my teacher, who basically gave the message that sex is bad and dirty, but you save it for the one you love. And even in 5th grade, that made no sense to me at all.
And your
And
response?
my response was, well, if it's bad and dirty, why don't I go and have sex with people I don't like?
Yeah.
It seemed to make more sense.
Budding sexologist.
Right. So
Right.
bad and dirty and save it for the one you love. So this sort of inherent negativity, which you used an important word a few minutes ago, that word salacious. We often run into issues professionally where we don't have the opportunity to talk about some of this stuff because it's just not sexy.
Yeah.
And, when you look at, I was even asked by a reporter a couple of weeks ago why shows like True Blood and Game of Thrones and Outlander and a lot of these shows that are very, very sexual in terms of what they're presenting, but there's also a lot of violence. There's also a lot of that salaciousness, that titillation that brings people in.
Yeah.
So it really, in a sense, I would have to say professionally, that even though we see sex out there more than we ever have before, it's in a way that I think I don't want to say cheapens it, but it kind of taints it a little bit. It keeps it in that marginalized area, and it's not bringing it into our normal everyday life.
Yeah. And, pick a sphere of sexual health, any approach you come up against this kind of, it's a group politically, right? If we talk about Planned Parenthood issues, people go, oh, women's issues. This. We talk about LGBTQ rights, people go, oh, them again, right? There's always this othering, right? We were talking about this earlier. Even
Right.
sometimes in the field, people fall guilty to perpetuating this kind of othering that we still, it doesn't help us just accept sexuality as normal. It's still part of, I think, a titillating thing that the first thing we know about someone is how they have sex,
Right.
or who they love, or what body parts they have. Like, why is that so important? Because of this overall
Right.
tone. when
And
it
and
comes
the way
to do with
people are
sex.
and the way people are identifying themselves. Now identifying themselves in the margins. I think there's a very strong parallel between. I think what you just said, that very often within the first few minutes of meeting somebody, we know their sexual orientation. Just like for so many people, in the first few minutes of meeting them, one of the first things we have to find out is that they're an addict or an alcoholic. It becomes this identity that they wear,
Right.
and it almost becomes their source of pride.
Right. Yeah.
And then a whole industry has kind of brought those two together,
Indeed.
right? Which is another one of our great bones of contention.
The sex addiction treatment industry.
Yeah. Yeah.
Wow.
Right?
It's-
Which kind of brought both of those things together.
Yeah.
So it's almost like now it's two great tastes in one, right? And
Two great shames that
yeah,
go
that-
better
that's
together.
Exactly right.
Yeah. And
exactly
to make
right.
to make a medical model, this is truly problematic. To have made a medical model now, I mean, it was shaky enough. This, I don't want to go into a whole tear, but the history of addiction as a disease. You know the story. We've been talking about it for 25 years. And I like how you describe it as a metaphor run amok. Right? It was whatever 1953 when the World Health Organization said that alcoholism follows the model, a disease model, right? A syndrome, a set of predictable symptoms, predictable outcomes without treatment, right? The disease model.
Right.
And from there, an industry was born 40 years later, 50 years later.
And they also say, ignoring that in 1963, the World Health Organization also declared the term addiction to be clinically invalid,
Right.
to be too subjective, to be too moralistic, and to be too arbitrarily applied.
Right.
And that's when we started using things like substance abuse, chemical dependency.
Right.
So, part of the running amok of these metaphors is also ignoring a lot of what really has been going on that just didn't feed the industry.
And the industry has been fed nonetheless,
Oh,
because
it's
again,
gluttonous.
you could sell more with fear,
Right.
with fear of sex, making sex this out of control demon that destroys lives. As we mentioned last week, the subgenre of sex addiction now, porn addiction. And again, we know from just so many cases that it's not about the porn.
No, it definitely
Right?
is
It's
not.
like, beating someone to death with a chair and saying, say no to chairs. Everybody stand up. Get all the chairs out of the room.
Right.
Right? It's just so missing the point.
Well, I mean, we often use an analogy, related to addiction of fire, right?
Yeah.
Right? Fire can be the most destructive force on the planet. It can also be the most beneficial. So is fire good or is fire bad? Do we just say no to fire because it can be destructive? Yet when it comes to especially things like drugs, and now much more rapidly becoming true for people as they talk about sex, and certainly porn, which, first of all, let's stop all of this utter nonsense about these henny penny declarations that the sky is falling. Porn is the #1 health crisis in the world. It's going to doom us all, and there's nothing more dangerous and more serious than pornography. I mean, it's truly nonsensical, but it's an
it's a bit
industry and
crazy.
it's making people money
Well, when is
and
it
feeding the shame.
Utah and then Texas followed suit, that the governors have declared
And I think Missouri,
public health crises.
yeah,
Like, come on.
the #1 public health crisis.
Zika virus
porn.
is a public health crisis.
No, I'm glad to know that
No.
we've gotten HIV beat.
Yeah.
We've gotten all sexually transmitted infections. We've beaten cancer. We've beaten cardiovascular disease.
I
It's
had
now
to-
all about porn.
I had to pull this up that I saw today because it just fell on the list of, well, we said we weren't going to call this show things that pisses us off, right? Grammatically. I don't think
That'll be the subtext.
we can't say piss at this hour. I don't know. Well, it's a sex talk, so I guess if we're talking about being pissed off, it's okay. You can't talk about being pissed on.
Yeah, that's
We'll
a
talk
different
about
show.
Peed on.
Right.
Pissed off is okay, I think.
Yeah.
But it's just, I hate to bash. I really do. And before I quote this, because it just makes my head want to explode, I want to preface it by saying, folks in the field, our dear friend David Lay, everybody that's involved in that wonderful Facebook group, if you ever get the chance to listen, I think you're all awesome and wonderful geniuses. The folks that are really fighting this tide of now, fast forward, addiction is a brain disease, and neuroscience is involved, and people, we've long past the days of it being just the great celebrity get out of jail free card.
Right.
I'm not a cad. I have a disease.
Right. See, it's not my fault I cheated on you. I have a
right.
disease.
And of course, always shout out to our friend and colleague Doug Braun-Harvey and his research and writing partner, Mike Vigorito. We all get it that the way around this seemingly endless debate is to just focus on a sexual health message, on a sex-positive sexual health message, and not banging our heads against this, sex addiction is BS. But it's so fun because it's just so crazy making, right? I got this ad for a training from the guy who started this, Patrick Carnes, PhD, who, it's almost, the training he's doing with this national training, one of these touring training organizations, and just the language and the description of this. First of all, he's talking about sex addiction as a problem, has 4 decades of research to help us understand the problem. I see 4 decades, almost, at least 25, 30 years of trying to find some research basis and some theoretical or some therapeutic nail to hang it on, probably hypersexuality, and jam these diagnostic criteria. And now 3 editions of the DSM later, trying and failing to
Each
get
time.
anything close to sex addiction recognized as a real thing. Okay. So
And by the way, I would say 4 decades of assertion, not research.
well, this Patrick Carnes, who's an addictions guy, right, with no
Right.
training in sexuality,
Right.
by his own admission, wrote this book and created the sex addiction industry in 1983, right on the heels of the HIV pandemic.
Right.
Of course, at which time, it took him a few years to recant. One time, famously, at an ASEC conference, after kind of give him credit for going into the lion's den,
Yeah.
but saying basically, more than just anything other than vanilla heterosexual intercourse in marriage is sex addict. So if you're gay, you're a sex addict. If you're kinky, you're a sex addict. If you're sexually active, with
you
more
watch
than-
porn.
yeah.
Fantasize.
But this kind of, again, standardizing around a disease model. Now this what's held up as a dual certification.
Right.
Oh, you're a sex therapist. I'm a sex addiction therapist. Like that.
They're like they're comparable.
Yeah. I really,
Well-
I hate to bash, but it's just they beg for it. It's
Well,
just,
yeah.
you
I
know,
mean, if
listen to
in the
this
interest of
language.
bashing, I'd say it's not. It doesn't involve training as much as it does drinking the Kool-Aid.
Yeah. Not only has our clinical awareness grown, but the problem itself is constantly mutating in that digitalized media has increased availability and options on an unprecedented scale. So, okay, here comes the zombie apocalypse.
Yeah.
Right? It's built a problem which used to be quite focused in age, now spans the lifespan from childhood to elderly. So everybody now, children are sex addicts, or vulnerable to being, and make sure grandpa's not spending too much time online.
Right.
Thinking about approach to, we need a whole new level of thinking how to approach our nation's #1 health problem, addiction. And in all of the addictions, sex has been the most difficult to talk about. However, no longer can any therapist not know the basics of an illness that is changing our culture. This is hysterical now.
It is.
Right?
It is.
This is pitchfork
and hysterical
torch
from the terms
hysterical.
of this reeks of hysteria, not like we can laugh hysterically at the absurdity of it.
Concrete tools, strategies, resource assessment will be explored to help deal with the inevitable patient. So they're not saying that therapists need to be sexually informed and aware and not avoid sex unless they're, I'm not a sex therapist, so I have to refer. They're saying, here are the skills to deal with this inevitable, these patients that are going to come pouring into your office as self-diagnosed sex addicts. And as you know, another of our favorite examples, if I go into an oncologist and say, I think I have cancer, and the oncologist says, great, let's start the chemo.
Right.
Will save me all that hassle
Right,
of
exactly.
tests and right. You don't start the treatment without a thorough assessment and an evaluation.
This is the only area that I can possibly think of in a professional realm where the so-called professionals basically accept the self-diagnosis. And they basically almost encourage patients to diagnose them for them so that they don't have to. They can just, okay, I got the handbook. I know what to do now.
Yeah.
Let's put you through the program,
Right.
which, and again, we don't have to say too much about how ineffective that really is and off the mark.
Well, so I think sex therapists know because they often get folks who've been down that road. Right? They get patients who've been to inpatient treatment centers and been told all kinds of things. We talked briefly on a previous show about this idea of iatrogenic harm, when the professional is injecting their beliefs. That kind of, trust me, you have all the signs. I know this. This is what you have.
Right.
Kind of problem. Inpatient treatment for masturbating too much, especially someone who's been in a sexless marriage, this kind of thing.
Yeah.
I think it's hopeful that many people who started in the field as sex addiction therapists are kind of waking up and getting it and getting trained as sex therapists.
Yeah.
While I can complain that all therapists should be sex therapists, they're not. And until they are, I'm happy to promote Modern Sex Therapy Institute's shameless plug, because we have to reach these therapists and train them. There has to stop this knee-jerk, I want it to be a tagline, right? Like plumbers that don't do toilets. This constant knee-jerk reaction, ooh, there's a sexual problem, I have to refer, is just another part of the crazy.
Well, the other side of that, too, in this sex porn addiction, industry, a lot of sex therapists and a lot of other therapists have it also in their head that, oh, well, if you're going to mention the word addiction, I can't deal with it either. You've got to go see a specialist because I don't work with addiction. You need to speak with somebody who works specifically with addiction. Now, let me interrupt some of the bash. I just want to be very, very clear that we are in no way denying or discounting the fact that some people have trouble with their behavior, that some people use sexual behavior, whether it's porn or partnered sex, as a way of medicating something, as a way of filling a need that they're not getting met, and it can get them into trouble. We are not in any way, shape, or form denying that. Right. It's the label of addiction. It's that whole concept, that whole slate that people are put through that basically, I'm sorry, is lazy because it's a checklist. We know we go from one program to another. The only thing that changes from patient to patient is the name on top of the page. treatment plans, aftercare plans are all identical. It's one size fits all.
Oftentimes,
And
yeah.
that is a problem.
Yeah.
Right? That's a huge problem.
But even a step back, from medicalizing something, we may not agree all the time in principle, but again, can't deny that like 12-step groups, self-help or fellowship support groups are really, really effective.
For
and
some.
have been for millions of people,
Yeah.
right? But when a treatment center, when basically a psychiatric treatment facility adopts the same culture, the same kind of, well, we have the formula, we've got the key to recovery, you have to want it bad enough.
Right.
That takes no accountability for its failure, right? I think AA is allowed to say it's a perfect program if you work it perfectly, but we know nobody's perfect, so you work it to the best of your ability.
Right.
But a treatment center that's just billed an insurance company 80 grand should not be able to go, well, I guess they didn't want it enough.
Right.
I guess you got some more research to do, right? We'll still be here when you decide you had enough.
Right.
And we won't charge you again after you relapse, like it's,
Right.
you know.
And it's probably the least expensive, 28-day program you're ever going to find is still going to be at least $20,000. And the pray and go to meetings really shouldn't be their strategy,
Yeah.
which it often is.
Boy, this half hour really sneaks up on us quick when we get to carrying on about.
Yeah, but I also want to say something too. Again, whether you're talking about, because right now I think what we also have to be aware of and ready for is that I think we're really blurring globally, the industries are blurring the lines between chemical addictions and behavioral addictions. And we're rapidly getting to a point where people are saying more and more that all addictions are the same.
Right.
And labeling them a brain disease. Right? Now, without getting too scientific.
We don't have the time.
Right. But I think it is, we can acknowledge that some of the things that the neurobiologists doing this work talk about, how with repeated behavior, brain changes. But we can change it back. We're not stuck.
Yeah, we have to continue this conversation next week. This is too juicy to hang on.
Yeah,
but
unfortunately,
we're out
1
of
minute
time.
to go is not a good time
Sorry.
to start that. But
Hopefully, people are going to start calling in. Maybe we've stirred some things up tonight. Tune in next week, Monday at 9 o'clock, Sex Talk with Dr. Richard Siegel. Thanks. Have a good week.
You've been listening to Sex Talk with Dr. Richard Siegel. Join us every Monday night at 9 on WNN, 1470 AM and 95.3 FM. Or watch live streaming video at AMP2 TV Productions on Facebook or look for the shows on YouTube. Thanks for tuning in, and we hope you'll join us again next week. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.